So I'm going to talk about a couple of tricks and tips that I have. So one of the first things to remember is when you're reaching for your butterfly catheters, what size we want to use. So we're going to do 25 gauge or our orange butterfly catheters for patients that are 50 pounds and less. So this is going to be all the way from a cat to about a 50-pound beagle. For every dog that's over 50 pounds, we're going to use 22 gauge. So this is even your Great Danes and big dogs. I'm not going to 18 gauge. I'm staying at these two sizes. And then rather than using a commercial tourniquet, I actually like hemostats. And you can use from your butterfly, you can use the tubing. So you're going to just cut one end off and then cut the other end off. And basically we just wrap this around the patient and then use this, which is a quick release. So this is actually going to be your tourniquet, and I'll go into how to use that in another series, but there's not a whole lot of tools we need, but these are pretty crucial. And then for your actual Euthazol, if this was our solution, we're going to want to dilute it 1:1. Because we're using smaller butterfly catheters, we're going to want to use, if let's say we're doing 5 mils of Euthazol, we're going to do 5 mils of water as well. So it's a lot easier to push and you're not struggling to advance that because it's too thick. So those are some of our tips and what we're going to use along with our hand towel to actually cover our solution at all times from the client so that they don't fixate and see it. Alcohol, and then we want to use clippers, cordless clippers that are pretty quiet as well. And I also like to use a small little bag. So in addition to all your supplies, this is gonna, you're gonna carry this to the patient. So another little tip is that for, you're gonna have your pre-drawn Euthazol in your syringe and have your butterfly catheter already hooked up to it. But in addition to that, you always want to have one extra butterfly catheter in your little bag. So if you're having difficulty and your initial attempt doesn't work, you have one on hand with you and you're not having to leave the room. You know, that can be a little too disruptive. So these are some of the tools that we're going to use, and in the next series we'll go over actually placing the catheter. The other tool I like is a hemostat. People have fancy tourniquets, they just don't work as well as simply using some of your butterfly extension set. You can cut both ends off of this and then you're just left with this piping that you can actually use for your tourniquet and your hemostat. And so what we're going to do is actually, if this was our patient, we're going to shave in a couple spots. So we would look here. We also could look by the accessory down here by the carpus. I'm going to put my tourniquet above the elbow, or if I was using a back leg, I would go above the stifle. I'm actually going to cross it like an X, and then I use my hemostat to secure it. And then that's going to help this become pretty raised and easy to see. Put a little alcohol in there, and that's going to be your entry point. Or if you're not visualizing that super easily, then you can go down here on the carpus, right above the carpus, right around in this area. This is going to be where you're going to see the accessory, which works really well on the dependent leg. So if our patient was laying on their side, this is going to be the leg that is dependent, or the one closest to the ground. Works really, really well. So once we're ready to place that, another trick I have is a hand towel. So I like to use a hand towel to always cover up the syringe so that the owner isn't looking at the syringe, they're not looking at the Euthazol. We can kind of hide everything we're doing so they can focus on the pet. And then I'll also tell them to just love on the pet and give them pets to get their focus away from what I'm doing. Also, I think it's really important to let them know that it may take a few moments, but you'll let them know before you start giving anything so that they're not stressing or anticipating when you're actually going to start and getting worked up about that. So the hand towel is really, really important. You want to do that for every patient, to cover your hands when you're working. So the next part we're going to talk about is actually placing the butterfly catheter. Okay. So now we're going to place the catheter. Again, what we want to do is from the moment that our syringe, I like to use a little bag that I will put the syringe and the butterfly catheter and my tourniquet and my clippers and alcohol in, that I carry right to the patient. So from the moment that this comes out of my bag, I've got a little towel over it so that, again, owners aren't not looking at that. They're not fixated or focused on the medication. And I'll put this down. And I can still access the medication underneath. And I can even check as I'm giving it how much I've given and all of that, but it's not in their view. With the end of the butterfly out the top, I'm not actually going to place this, but I'm just going to demonstrate a couple things. I like to use the wings, and then I'll hold the pet's leg. This would come off. We're going to actually place this with the bevel tip up. A lot of times you may not actually be able to see the vein, but you can feel it. It's kind of bounces a little bit off of your finger. And sometimes even if you can't feel it, especially in a dog that's overweight, sometimes you have to go by anatomic location. So you know it's going to be running in the middle of the leg, in the center. Having said that, I will check if I do not see the vein here, cannot feel it, I will check for the accessory near the carpus. I'll check the back leg as well. If I can visualize those and the veins look straight, I would use those over one that I can't see or feel. But assuming I can feel the vein right here, what I do is I make sure that I'm going completely parallel into the vein, and I'm kind of sliding. So I would enter here and I would slide upwards, making sure that I'm staying parallel and flat, that I'm not going deep, I'm not going superficial. I advance extremely, extremely slow. In fact, sometimes I'll almost meditate to slow down my breathing and make sure that I'm advancing very slow, because as soon as I see the smallest bit of flash here in the tubing of blood, I know I'm in the vein. I will stop. I do not advance the needle completely into the vein as you would in clinics, where you advance all the way under the skin until you don't see the needle. I'll actually stop as soon as I have a flash. When I have that flash, what I'll do, so we'll say that this is underneath the skin at this point, and let's say I have a flash, I'll actually hold and place a finger over the butterfly to ensure that it doesn't move any further forward. And then I'll roll my thumb along to the back of the leg. Now I'm making sure that this butterfly, this catheter, isn't advancing, it's not moving, it's going to stay exactly where it is when I first got that flash. And then I'll take my other hand to the syringe. I'll pull back a little bit, make sure that blood is still going backwards in the tubing. That's telling me I'm absolutely in the vein. And then I'll start slowly. I'll take the hemostat off, release it, and I'll slowly start giving the medication. It's really important that when you start giving this medication that you go very, very slow. Otherwise, you start to see that the breathing rate increases and they start breathing fast or heavy. And that's when you know that you're actually giving the medication too fast. So those are some of the tips I have for placing the catheter. The big ones would be going slow, stopping when you have a flash, not advancing any further, and then putting a finger over the butterfly, and then I roll my thumb along the back of the leg to secure my position.